with that, I mean, a good death needs three things. It needs equipment, it needs medication, and it needs the staff to administer it. So in terms of equipment, a few quick questions. Do you have enough syringe drivers in the NHS to deliver medications to keep people comfortable when they're passing away?
Yes, we do. There was a challenge raised about this about 8 days ago, and we resolved. Actually, it wasn't as big a challenge as was made public, and we've resolved that. So yes, right now we do.
And the second one is with that's the syringe drivers deliver medication, particularly things like midazolam and morphine. Do you have any precautions put in place to make sure we have enough of those medications to be delivered?
Yes. We've got a big project to make sure that those sorts of medications, as well as the ITU medications that I spoke about earlier, that the supply chains, the global supply chains for those medicines are clear. They are, in fact, those medicines are made in a relatively small number of factories around the world. So it is a delicate supply chain, and we are in contact with the whole supply chain.
And in line with that, morphine is currently prescribed per patient. The reason to do that is stop it being abused. So I have to prescribe it for Mr. Hancock. However, in this situation, if you're going into a healthcare home, you may not want to waste precious things like morphine. Have you considered relaxing the laws around morphine prescribing for doctors and healthcare professionals so that there isn't waste?
That's something that we keep under review. I've looked at that particular point to reduce wastage of key medicines, and it's something that the supply team, in the department and the clinical team talk about all the time. I don't know if that's JVT's part of the clinical team, and he may want to say more.
Thank you. I've nothing really to add on that.
Okay.
Okay. Thank you, Rosie Cooper.